Good morning. My name is Arniela. I'm an expert in social protection specialist for FAO, and this event has the purpose of present the main results in a joint study made by FAO and IPCIG to analyze the response to social protection in rural areas in Latin America and the Caribbean, and to recommend policies and tools to advance toward integral systems of social protection that contribute to the transformation of rural areas. So before I begin, I'd like to remind you that we have simultaneous interpreting to Spanish, English, and Portuguese, and you can activate that by means of clicking on the globe icon below. So COVID-19 pandemic has had serious economical, social, sanitary impacts in the region. In 2020, the poverty affected 33.7% of the population, and extreme poverty 12.5%, reaching levels that were not seen in the previous 12 years before. Before the pandemic, the largest poverty in rural areas was a structural characteristic of the countries in the region, especially because of the lack of income from independent workers and less cover of social protection systems in these zones. The pandemic, no doubt, made the situation worse. The estimated rural poverty rate in 2020 reached 56.2%. That is something similar to what we had in 2005. And extreme poverty in rural areas went back to levels of 15 years before, reaching 23.4% of the rural population. In this context, social protection has a central role to mitigate the social and economic impacts of the pandemic. In Latin America and the Caribbean, there are many social protection measures implemented, and they included the horizontal expansion and vertical as well of assisting programs, and also new programs designed specifically to respond to this emergency. This process had several changes in innovation that included the expansion of identification and registration processes, and also other measures for transfer of income and the strengthening of delivery systems, including the use of technologies, among others. However, the nature to the response in many cases was short-term, and it was insufficient to think about a strong economic impact that the pandemic had, especially for the population that works in informal sectors and in more vulnerable cases. And many live in rural areas. Before the pandemic, the country's either area faced a lot of problems in terms of access to social protection. Great deal of the population did not have proper protection, especially in rural areas. And at the same time, the majority of the programs did not incorporate the design and implementation to answer to particular means in rural areas, limiting the access of this population to systems due to economic barriers, social, cultural, and administrative barriers as well. And that did not allow these people to use those instruments. In this context, the study that we are presenting today has a special relevance and seeks to identify innovations and lessons learned for these problems in the Latin America and the Caribbean, in order to identify recommendations for policies that help us strengthen the reach of the social protection measures in these areas to rebuild better. This is not only to mitigate the impact of the pandemic, but to also strengthen the homes so that people can rebuild and have better economic conditions. And a key point is to promote the implementation that include social systems by promoting the means of life, so that it allows us to tackle simultaneously the multiple social vulnerabilities and social and environmental as well faced by rural populations. Currently, we are in a process of completing the documents. They will be published approximately in January of the next year, and you will be able to find them also on our website, both in FAO and also IPC IG. And so to present and discuss the results of this study, we will have the presence of 6 distinguished panelists. First of all, we will hear from Carolina Trivelli and Fabio Veras, and then we will hear from Beatriz Burattini, who will talk about the main findings of this study. And then we will have representatives from different governments of the region. First of all, we'll have José Bernardo González, who's going to talk about the Plan Panamá Solidario. And then we'll have José Carlos Araújo Mercedes Jr., who's going to talk about the experience of the program Garantia Safra from Brazil. And after that, we will have Abid Elias Bacha, who is going to talk about the experience of the Dominican Republic in the implementation of programs Quédate en Casa and Superate. And finally, Alejandro Greenspun will give us a few words about the presentations, and he will moderate the Q&A session afterwards. So we invite you to participate and send your questions by means of the Q&A box below in your screen. And so to begin, I'd like to introduce Carolina Trivelli and Fabio Veras, who will talk to us about the relevance of this study for FAO and for IPC-IG. Carolina is a master's in agrarian economics from the Pennsylvania State University, an economist from the Catholic University of Peru, and currently she is working as an advisor for the regional office of FAO for Latin America and the Caribbean. And Fabio Veras is a doctor, has a PhD in economics by the University College London, and he works as a researcher in the Applied Economic Investigation Institute, IPEA Brazil, and is a coordinator of IPCIG. So without any further ado, I will pass the floor to Carolina so that she provides us with her initial comments. Thank you very much, Aniela. It's an honor and a pleasure to be able to be here today. I believe that from FAO, one of the most important initiatives that we have to support is lessons learned and action routes based on what we learned about how the different countries faced the crisis generated by COVID-19. I'd like to mention in these few minutes 5 themes that seem essential to me, and they are a result of the studies. Beatriz, if you please show the presentation. I believe that they are crucial and we should pay attention to them during this session. First of all, the importance of the political factor, the attention of politics in our countries toward the needs of the rural population in a crisis. I believe that here we have a lot to learn, because I believe that who works in the rural areas, people get our space very easily because of this dramatic situation that urban population faced, because they saw this significant leap in their levels of poverty and vulnerability. But rural population also faced dramatic situations, as we're going to see in a bit, but clearly the discourse was won by, well, now we have to pay attention to urban poverty because they suffered the most. And thus, there was a minimization of what Agniela mentioned. Rural poverty was already much higher before the pandemic. And if it did not go up so much in terms of the urban population, it did get worse. And Colombia is an example of that. However, in the recovery processes, urban economies will react faster than rural, and rural poverty not only got worse, but it remained a theme to be tackled. And I believe we need to build together a discourse, a speech, and a narrative so that the politics in the good sense of the countries in the region do not forget the rural world and its peculiarities and the seriousness of poverty and vulnerability for these populations. That was one thing. Second thing is that one of the things that we thought about in the study is the importance of having a social infrastructure on which to base emergency programs. As we're going to see in the case studies, a lot of success came from having something based on processes that already existed so as to broaden them and made them better. And I believe that this requires us to have better maps of infrastructures, of programs, information, for example, national records, and to acknowledge that a rural population has information so that we can have this basic infrastructure on which to build emergency programs. A third comment has to do with the importance of our allies and the identification of who they are in the rural world so that we can have social protection in an effective manner. I believe that social organizations are important, community organizations that are there working for the rural world, and they came up together in the social protection network of the public sector to face this tragedy much more than in urban areas in our countries, but also actors from the private world, financial institutions that contributed and facilitated the delivery of monetary transfers, or companies that sell products and they allowed countries to generate useful information to feed records that could allow for the help to arrive in emergency moments. A fourth comment, Arinela mentioned that, and we discussed that in this session, the importance of having within these efforts of social protection to have efforts for economic inclusion that ensure this reactivation processes of the economies of our countries can get to rural areas and can build back livelihoods, but also have to do with the recovery of rural jobs, both in agriculture or not. And that is especially one of the sources that suffered a lot. And I conclude with innovation and the opportunity of digital means. We saw an accelerated use of digital innovation during the pandemic. We also saw the problems in terms of connection that we had and digital skills from groups in rural populations. And so there is an opportunity to generate more and better tools, making use of technology, but not trusting it entirely, because we should acknowledge the limitations that they have as well. So I believe that those 5 themes can be used for our discussion that is very interesting, and it can be fed by the cases that we're going to discuss. And so in FAO, we have a strong commitment to build knowledge based on experience, not only to have better social protection for the rural world, but also to avoid this population to face crisis with so little tools, which was the case. Thank you very much. Thank you, Carolina. And yes, we will discuss a lot of these points that you just mentioned. I'd just like to talk about the first point, the political factor. It's very important to be able to build this narrative that boosts this agenda. So not only rural poverty will get worse, but we run the risk that it will remain there. And this is a very critical situation. So Fabio, now you have the floor, so you can share your initial comments with us. Thank you very much, Arniela. Thank you very much, Carolina. It's wonderful to have you here. Good morning, good afternoon to Alejandro, who's in Rome. As you all know, since the COVID-19 pandemic, the government's adopted or adapted social protection measures to contain unemployment, and food insecurity, among other negative effects of the sanitary, social, economic crisis caused by the pandemic. Many maps and a few studies centered on describing and analyzing the policies that were adopted. And among these studies, we have the map done by IPCIG for responses in social protection for COVID-19 and other countries in the global south. This map, as was mentioned by Arniela, identified 413 social protection policies that were adopted or adapted to respond to the crisis for 39 countries in Latin America and the Caribbean. And then you include measures of the three components of social protection, which is social assistance, security, and very important to the job market. Despite many studies done about these policies, the debates about the effects of the crisis and the capacity to answer and to respond to the special needs of rural populations, they are still not enough. However, if we want to build a more egalitarian region in the post-pandemic period, it's extremely important to generate knowledge about social protection for rural populations. It's a marginal group traditionally. So the International Policy Center for Inclusive Growth and the Food and Agriculture Organization Regional Office for Latin America has joined forces to understand all of this and to get lessons that can contribute to build national social protection systems more inclusive for these populations. The COVID-19 pandemic talked about the faults of the current systems and could be an opportunity for countries in the region to have more inclusive and efficient systems and also resilient. However, the crisis also drew attention for new possibilities, and Carolina mentioned a few of them, to improve these systems for rural populations of the region. For example, there was a greater involvement of new government actors in these social protection measures. In addition to the ministries, the participation by the ministries of agriculture and livestock in the design of protection policies that were specific for rural population can contribute to social protection systems that are more integrated and inclusive. And the results presented in a series of three informs of policies developed by the IPCIG and FAO teams bring a series of lessons that were learned during the pandemic and in the food protection and jobs in rural sectors and agricultural sectors, and also the theme of digitalization that can help us in the process of building back better. So I wish you all a great webinar and thank you very much for all of your participation. Arniela, you have the floor now. Thank you very much, Fabio. For us in FAO, it's a pleasure to contribute to IPCIG, and I hope we can still make efforts and joint efforts to boost this agenda that is so important in the region. Now, I'd like to introduce our first panelist, Beatriz Burattini. She is a master's in social policies and development by the London School of Economics, and she studied international studies in the Leiden University, and now she is working as a researcher at IPCIG, where she provides technical assistance for the analysis of social protection policy, especially in Latin America and the Caribbean, in collaboration with international institutions like UNICEF and FAO. Beatriz is going to talk about a summary of the main findings and lessons learned from these three studies called COVID-19 and social protection in rural areas from Latin America and the Caribbean, lessons to build back better. Beatriz, you have the floor. Thank you very much, Arniela. Thank you, everyone who's here. Well, first of all, let's see if you can see my screen. Can you see my presentation? Yes? Well, as Arniel explained, I'm going to very briefly mention the findings of our study with FAO. And so the study included 3 reports about different themes. The first talks about double inclusion, so how to ensure interventions that are articulated of social protection and economic inclusion, and how to ensure food security by means of this connection. And to analyze that, we studied 4 different case studies. The Critical Assistance Program that's directed for family protection, PACID, and Contingency Emergency Response Component from Belize, and Bien Pesca from Mexico, and Plan Panama Solidario from Panama. The second report, we analyzed the protection and the promotion of jobs. More specifically, how can social protection can improve the promotion and protection of rural jobs, and how can we tackle the risks for rural workers? Here we analyzed 3 case studies: El Garantia Safra from Brazil, Sembrando Vida from Mexico, and Haku Wiñay in Peru. And finally, for the third report, we analyzed how digitalization can support the effectiveness and the access to social protection in rural areas of the region. And so here we analyzed 3 case studies: the food acquisition program from Brazil, and El Quédate en Casa from the Dominican Republic, and the Bono Rural from Peru. And while in all reports, we were interested in the same methodology, we started with an initial mapping of the IPCIG from last year, in which a lot of researchers mapped the responses of social protection to the pandemic in all of the world. And so we focused only on rural populations and on the measurements of Latin America and the Caribbean. We also created an articulation for the 5 factors, but I'd like to remind you that it's not that the programs needed to correspond exactly to all of the 5 factors. So if a program was interesting in terms of population that was benefited, innovation, availability of information, we allowed the inclusion of programs that, for example, did not have a super sustainable funding. And well, after selecting the case studies, our research led us to a review of the literature and interviews with government officials working on these programs, but also from scholars from the different countries, and also FAO officials. And so I am going to focus on the common factors for success and a few specific examples that are interesting from the programs of the countries that are represented here. And so the first report, the most important things were something that was also mentioned. All of the programs were based on pre-existing structures. So the case of Belize and Mexico, there were pre-existing mechanisms to respond to shock. And in Argentina and Panama, there were social protection programs that already existed. For the example of Belize, there were already these infrastructure projects between the government of Belize and the World Bank. And when the crisis began of COVID, the ministries of agriculture and human development only had to request the allocation of funds to implement this program, which is basically, well, the version implemented by the Ministry of Agriculture is basically money transfer to provide a productive input to agriculture and to farmers. And there's also a version from the Ministry of Development, which is money transfer that is normal, but both combined supported the offer and the demand. And also I'd like to say that Argentina, Belize, and Panama also used social records or pre-existing records from the rural population, and they could collect data very quickly during the pandemic. And they talked about the importance of having these data. In Argentina, for example, I'd like to say that they have an emergency program that offers financial support to small scale farmers, and they used national records for that, not only to find the people, but also to connect the program to other social protection programs for these existing groups. So there are a lot of findings. I'm only going to focus on some of them. Another thing was the intersectoral articulation by means of development strategies like in Panama, and the connection with other social protection programs, as I explained in the case of Argentina, and the participation of the different ministries, as just explained in the case of Belize. The ministries worked together with the program, but they did not do that actually, but they implemented programs that complemented each other. And because of lack of time here, I'm going to talk about the next report. And so here, also common success factors that were important because all of the programs were based on a pre-existing infrastructure. For example, in the case of Peru, in Hayatay and indigenous women in Mahakunyai, those are programs that are new, but they have a history of social protection and economic inclusion that existed in the Andean region. And this experience was transferred to the indigenous context with the help of indigenous associations. Just to explain to you, it's a technical support program with trainings and all. And I'd also like to talk about the importance of political will that was mentioned in the case of Mexico and Peru. And in Peru, it was very interesting. The minister responsible for this program created like a window of opportunity by inviting indigenous associations to work with officials that were already working with this type of program in Andean regions to cooperate in the design of a program. And well, I'm going to the next report because of lack of time too, about digitalization. Here, the main finding was that the digital innovations that we found, they were all based on lessons that were already developed before the pandemic. So for example, the PA from Brazil, they used an offline app to facilitate the registration of small farmers and also the monitoring of cooperatives. But that's something that already existed and that facilitated the implementation of the program during the pandemic. And similarly, in the case of Peru, something that was very interesting that we found was that the implementation by means of digital technologies benefited a lot from the infrastructure that already existed. And they have tambos, which are they're places that offer certain social services in remote areas, for example, civil registration. And so the beneficiaries could request money transfer by means of these places, tambos and bias. And bias are like boats that go through the river, and they facilitate access to remote areas to public services, including registration. And these boats are connected to the internet. And just to conclude, a few interesting findings among the reports. Well, we talked about infrastructure and pre-existing records, but we also have the collaboration with non-state actors, for example, associations in Argentina that also participated in the design. In Peru, the indigenous associations also worked on that. In Brazil, the PA, the cooperatives, and they facilitate access of farmers to digital technologies. However, an interesting obstacle that we found was, well, there are technological barriers because of the digitalization. Sometimes the use of technology can exclude people. So we still have to consider if that has sense just because of innovation, if facilitating access would only be because of that. But working with indigenous associations and small farmers, those are groups, rural groups are marginalized and they have a history of exclusion. So a few countries like Peru, Mexico, and Panama mentioned a few problems when they registered those beneficiaries because there was a lack of trust because of historical issues. There are a lot of interesting findings. You can ask me later about specific case studies. And we will also hear from the experiences of Panama, Brazil, and the Dominican Republic. So thank you. Thank you very much, Beatriz, for the presentation. Each of those three political reports that Beatriz just mentioned have important contributions for the area, as well as concrete recommendations that we can do once the reports are published to advance toward pertinent social protection programs. So aligned with what Beatriz said, I'd like to talk about 2 points that we consider very important at FAO. The study allowed to see that most social protection measures implemented during the pandemic did not contemplate significant parts to talk about specific needs of the rural population. Those were general measures. And at the same time, the scope of the social protection measures and other practices were very limited in these results, given that they focused especially on workers in the formal sector. And this makes us talk about the expansion of the cover and the access of social protection systems to attend to specific facts in social areas and also to adequate the design and implementation of the programs of the particular characteristics of social populations in the rural areas. And it's important, as Beatriz says, to talk about programs that prioritize groups that are most vulnerable in these rural populations. For example, this series of studies includes Bien Pesca program in Mexico that talks about small fishermen, and they are usually excluded from social protection programs. And we also have the example of Sembrando Vidas that are focused on indigenous groups with women. And also a particularly interesting case is the program Nueva Mujer Indígena, in which, as Beatriz said, the articulation between the Social Development Ministry and indigenous associations allowed to implement a program that responds better to the characteristics of the native communities in Loreto, incorporating this intercultural scope. On the other hand, we also believe it's key to look for synergies between social protection measures and in social and economic inclusion policies. We believe that this is very important for new strategies now looking at recovery processes. And here an example that I'd like to mention that Beatriz also mentioned in her presentation is the case of Panama, in which the Agrovida program was articulated territorially with a strategy to reduce poverty in the Plan Colmena, which is a government program from the Ministry of Agriculture. So this is a type of synergy that is interinstitutional, and it's key to establish strategies to reduce the rural poverty, and it's sustainable. And finally, a last comment that I'd like to make. The study shows the key role played by rural organizations in the implementation of the programs. And that happened in Brazil, Peru, Mexico, involving the communities in the design processes, implementation, and evaluation of these programs. That's very important to ensure that the social protection services are proper and relevant to the needs of the potentialities of the communities that are going through the interventions. And now I'd like to pass the floor to the government representatives. So I'd like to introduce Mr. Jose Bernardo Gonzalez. He's the Director of Rural Development from the Agricultural Development Ministry of Panama, and he's going to talk about Panama Solidario Program and Paraná Agro Solidario Program, emphasizing the synergies between the different components of these programs and explaining how government institutions organized to have articulated response in these rural areas. So you have 8 minutes, Mr. Gonzalez, to speak. Thank you for the opportunity. Can you hear me? Yes, we can hear you. Well, I'm here in the province of the country in the Caribbean, and we're seeing an inclusion processes for agricultural programs. And so we have an experience, and that was difficult to implement because of the registration system that we did not have. It was not strong enough. But in our path, we sought to articulate and have a strategy that we developed since 2019, which is Plan Colmena. And we wanted to articulate the public services in order to identify and prioritize the people who need the most. So we have been working on this theme of education registration of people who are poor and vulnerable. And we wanted to advance faster in the identification of these people, and because they're suffering from the pandemic especially. So we created the Plan Panama Solidario. That's how we created the Solidarity Panama Plan. So in this plan, this is an emergency plan, and it's to alleviate the poverty, especially for those people who were affected by the pandemic. And there were several fundamental actions that were articulated, and not just to deliver things to those families in the rural areas, to deliver food, but we wanted to have these digital bonuses. We wanted to use that by means of our authority. So every month we could give and transfer a bonus. It begins with $80. It began with $80, but then $120 per month by means of a card. 1,400 families benefited from that on a monthly basis. And in terms of food, a little over 10 million of those bags with food were delivered to the population, and the logistics were done by different ministries. And after the vaccination, we began that very quickly as we could, so that we could leave these economic and social problems because of the pandemic. We wanted to avoid people to die or collapse in the health system. So that's why we vaccinated very fast. So we articulated several programs. Vale Digital, which was to deliver money so that people could tend to their basic needs in terms of the purchase of food and drugs by means of physical bonus in a few places, more remote areas, and also digital bonuses in other areas. In addition to these bags of food and of these bonuses, money, we wanted to implement a program for food in schools, and that had two components. We wanted to benefit the children, and we organized the delivery of food in many of the cases in which we had mobility to deliver food in places and houses where the schools were. Because in Panama, we have a program of children eating in schools, but in 2020, we began a program to have complete food in schools so that the children could have lunch in the schools. However, when we began the program, there was a pandemic, and so the mobility was restricted. So they started to deliver the food at homes. And the purchase of these foods to families was done. And so that was a program that we articulated in the Colmena plan. I should clarify, and for those of you who do not know the Plan Colmena is the articulation between different institutions in territories that have more vulnerability. Another thing that we did in this Panama Solidario program was this Panama Agro Solidario that had two components. One that had to do with the production that was commercial, so that the food production activities for the market did not stop. And so we created a program of loans with 0% interest up to $100,000. It used to be 50 and then it became 100. We had a credit with the Inter-American Development Bank so that we could have this commitment and deliver these loans to farmers. And generally, those are the small farmers. And also, we worked with organizations like FAO and the World Bank to begin a program to support indigenous women for food security and also that they could have income to sell things. So this program, it's MIDES, together with the Ministry of Agriculture, and we benefited our more than 3,000 women in several themes. The theme was to have tools and input so that they could keep working in the productive systems in indigenous areas who benefited from this network of opportunities given by this money transfer program. So we used the basis of records that we had from the network of opportunities so that we could incorporate these women in this program, especially in a place where we began, very specific. And in this year, 2021, we began in other rural areas, which are close to Colombia. So at the end of the year, more than 100,000 women should be benefited, and we provide training and technical assistance together with the Ministry of Agriculture. I don't think the slide is there. I should have included that because articulating this program, Panama Agro Solidario, and the other one, there's the Olvida program, and that program was to deliver to the most vulnerable families seeds and tools and training. That was part of the program. That was a national program. So in all the provinces, they started to deliver these things and to provide technical assistance so that the families could produce their food. And also we began a program of a system that is extension system that is called an extension system focused on the improvement of life, which is to support the most vulnerable families who were suffering from the pandemic with a lack of food, with a focus on the importance of tending to those families with their internal problems and who were also affected because of lack of mobility and restrictions. And poverty created internal situations in the homes that were very hard. And so we wanted to have social programs to support these people and improve food and hygiene for the kids and also the relationships within the families. So these were the main programs that were articulated to work with these people. So a lot of things. You have Vale Digital program and the food bags that were bought with national products to improve our local economies as well. And after 6 and 8 months of that, we even decided to incorporate that to make the purchases better, to buy from organizations of farmers. So we allowed for farmers to have a more direct relationship with the organization, and then the organization with the state who purchased by means of the institute, this commercial relationship. And that gave more transparency to the system. And so, as I said, the digital bonuses and food programs and other programs for the schools to feed the children, and Agrovida program, who delivered seeds and tools to farmers, and also the Ilusión Productiva program that focused directly on the women who benefit from that. And so we are transforming these programs to improve the quality of life of the families, since there was a problem because of the pandemic. So that's what I had to say for now. If you have any questions, I am available at the Q&A. Thank you. Thank you very much, Mr. Gonzalez, for showing us such an interesting experience. So a few things that I'd like to say is the articulation between the Plan Panama Solidario with the public purchases for families to ensure these food bags, and also to ensure that the producers sell. And it's very interesting to have this productive, inclusive as well, and Panama Agro Solidario to support indigenous women to ensure their food security and to strengthen their ability to sell things. And here, since you used the basis for registration for these programs to incorporate them to another inclusion program, I think this is a clear example of articulation between the Social Development Ministry and the Agriculture Ministry. And another element that is relevant is a program that is focused on territories that are covered by the Colmena plan. So it would be very interesting to know how they articulate new interventions in the territories. Maybe that's a point that we could talk about in the Q&A.
Pero ahora me gustaría presentar a nuestro
But now
siguiente.
I'd like to pass the floor to our next speaker. It's Mr. José Carlos Araújo, the coordinator of the Garantia Safra program from the Ministry of Agriculture and Livestock of Brazil. And he is going to talk about the experience of this program that existed before the pandemic, but there was a role to protect small farmers, vulnerable farmers during the crisis. Mr. Araújo will talk about the main characteristics of this program, what were the adaptations during the pandemic, and also things that have been discussed to articulate this program with other institutions. Mr. Araújo, you have the floor now.
Olá, Niela. Boa tarde a todos. Vocês conseguem me ouvir?
Hello, good afternoon. I hope you can hear me well. Okay. So first and foremost, I'd like to thank you for the invitation for being here. I am the coordinator of the Garantia Safra. This has been institutionalized and exists since 2002. And that due to the pandemic, we've had some adaptations to try and overcome the challenges with the COVID-19 pandemic. I'll try to be brief, but first and foremost, I'd like to thank you and make myself available for whatever questions you might have. Next slide, please. Well, Garantia Safra, or crop guarantee, it is in the National Program for the Strengthening of Family Agriculture, known in Brazil as PRONAF, that aims at guaranteeing minimum conditions for the survival of the family producers of municipalities that systematically subjected to the loss of harvest due to the drought or to the excess of rainfall. It has been created in 2002, so it was created a Garantia Safra Fund that has a financial nature, and it's under the Ministry of Agriculture, Livestock, and Food Supply. And since then, this guarantees it was instituted aiming at the regions of the northeast and north of Brazil. Around 10 states are part of this program, and we see to almost 1 million inhabitants per year per crop. So to work on that, there are criteria in our target audience or participant target is extremely vulnerable, and they need PRONAF aptitude. This is a document that proves that that person, that producer, has characteristics of rural producer. They must have a family, monthly family income of, so the sum of all members of that family unit to be 1.5 minimum wages, and to plant a small area from 0.6 to 5 hectares of beans, corn or maize, rice, cotton, and manioc or cassava. So I'll show you a flow, if you could, to see how this program works. It is divided in 3 larger macro processes. The first one is the implementation that goes from the enrollment of this user to the abort. Safra Guarantee is a program that has co-participation, both the family producers that joins the program, as well as the municipalities that they are part of. They enter co-participation, and they join the composition of this fund, of the Solidarity Fund. And most of the resources is made available by the federal government of Brazil, where every year the government has made available for the addition of income something around 468 million. These resources will be mandatory, so they are mandatory with the federal government. They must make use of these resources to work with those producers. Having this process, this first macro process of the implementation that goes from the registration to the addition. So there are criteria for analysis and that to verify if those producers who planted, if they had the loss of production. So we have analyzed 4 indexes for the institutions developed by INMET, the National Meteorology Institute, and CIMADEN, the Natural Disaster Monitoring Program, and IBG, the Brazilian Institute of Geography and Statistics. So having this analysis of those indexes, well, if in 2 of them it was proved the loss of above 50%, it is made available a benefit of 850 reais for these producers who are part of the program. So this flow is what would be in the normal conditions. Due to the pandemic, we've done some adaptations, and I'll tell you what happened. So I brought the relevant points, which is mandatory expense. So the federal government, the government of Brazil mandatorily, they must make use all 460 million. and the co-participation of the producers and state. There's a flexibility, a regionalization of the timeline of implementation, the guarantee of this value of 860 reais for the ones that have the loss. Regarding the adaptation, many services, they were done physically. So in person, the producers need to send the ministry and the state should there has been a loss of the benefit. So a blocking of the benefit. So they to try and unblock it physically. So there was all the proofs. There was a need for them to eventually see or defend themselves from irregularities, and they would send that physically, and it would take too long for answers. And we had the operational issues that the producers now they do it online. So there are improvements in the rules due to the pandemic. In the losses, there's a part. There are professionals that they need to visit the property to see if there has been losses or not. And due to the pandemic, we suspended those reports. We only considered the data of the research institutions to be able to prove the loss of productivity, the yield, and made the resources available for these producers. Another adaptation was a single payment. Before the pandemic, this value of 850 reais was made available in 5 payments. Now we do that in a single lecture, and now we'll continue that because there has been a great effect in Brazil. So, and there's the migration to the producers, they didn't need to go in person to the institutions responsible for that to enroll in person due to the pandemic. In what we have implemented before, they were done automatically. We did this work of automatizing the registration. Now I pass if you could pass the floor to the next, I'd like to thank you. Well, in the future, we've been discussing that even before the pandemic, and the pandemic made us move forward in this issue of the restructuring of the program and the link of the program and the production, even the positive inclusion. So we link this benefit not only to the loss of productivity. We know our producers are extremely vulnerable, and they'll have the loss of productivity. So the idea is for us to have this the benefit together with a technical assistance. So although it has been institutionalized for 20 years, there has never been an interface with other public policies. So here we have a proposal of linking this benefit to the technical assistance. And with that, the elaboration of research and consultancies applied to the rural communities. So now the producer has a knowledge what has been planted, what is the best period, what is the best calendar. So the training of technicians, students, residents, and also the social activism being boosted in the commercialization of products. So we are aware that the Garantia Safra cannot be only assistentialist or cash transfer program. No, we need to create relationship with other public policies, with empowerment and the development of producers. So, and now we close with this slide. Here we have my contacts here in Brazil, and once again, I'd like to thank you for the invitation, and I make myself available for any doubts or any questions. Thank you.
Muchas gracias, señor Araujo.
Thank you, Mr. Araújo. Really, the program has a crucial role for small farmers in the region, except for a few countries. We see that these instruments face a lot of difficulties, and you have to consider family agriculture. So that's why this case seemed especially relevant to me, because it's a sector that is exclusively focused on small farmers with low income and in a vulnerability moment. So it's important to see how the pandemic accelerated this in the program and its connection with other interventions, technical studies, trainings, incentives to associations. I'd just like to emphasize the last comment that you mentioned, that Garantia Safra cannot be just an assistance program that is essential, but you need to articulate that with other broader public policies. I believe that is a key theme that is very important. So now I will introduce our last speaker, Mr. Adib Elias Macha. He's a Superity Social Innovation Accelerator Coordinator from the Dominican Republic, and he's going to talk about how the many different programs from the government organized to have an articulated response that ensures social protection to rural poor communities during the pandemic, and how technological innovations contributed to this process. Mr. Bacha, you have the floor now. Good morning. Thank you very much for the opportunity. And the Dominican Republic, since January 2020, the country already used all the epidemiologic control mechanisms to mitigate the effects of COVID. So the recommendation was made by the World Health Organization in previous weeks, and it had a series of measures to be able to protect the health of the population. So there was a emergency center that was activated as a platform for the coordination of the preparedness of the response, and we configured interinstitutional panels to regulate the response, and also we updated protocols and procedures for labs and monitoring in central points. We established controls in airports and in the borders, among other measures. However, at the end of February 2020, we detected the first case of COVID-19 in the Dominican Republic. And after 20 months, 29 October 2021, the number got to 380,000 cases that were confirmed and more than 4,000 deaths. So really, as Carolina mentioned in her introduction to this webinar, according to the statistics from the Ministry of the Economy, Planification and Development, the monetary poverty rate went from 21% in 2019 to 23.4% in 2020. And that meant that more than 268,000 people went into general poverty, and the percentage of people in extreme poverty was raised from 2.7 in 2019 to 3.5 in 2020. The monetary transfer programs were the main response to reduce the negative impact of the COVID-19. In the same way, the articulated response of the government to the crisis allowed to put forward programs like Quédate en Casa Fase, Bati, which were extended to December 2020. And these programs, especially Quédate en Casa, were the ones that mitigated the fall of income by means of money transfers that were direct to the most vulnerable places, and that allowed for more than 500,000 families to survive because they fell into poverty. With respect to the model of this presentation, we will begin by answering a question. Which aspects of the program Quédate en Casa, just like the Prosoli program and the Superity, were crucial to ensure social protection of the rural population during the pandemic? In the Dominican Republic, when the crisis began, we had an institution called Progresando, con Solidaridad that transformed by means of credit, 377 from 2021 that we constituted the Soparati program and a social innovation accelerator coordinates that. And so the place that regulates that still exists as a place for coordinating the answers when we had the moment of the pandemic. So it articulated the management of three institutions. One of them was the sole beneficiary system that wanted to identify, categorize, and see vulnerable places in terms of the quality of life, etc., and the administrator of social benefits. And that was the unifier of payments and social subsidies granted by the government. And at this moment, Protosoli, which is the operational arm and also a social arm of the program, gave the participants of the program, in addition to training and technical assistance and follow-up for them to be included in the production market by means of jobs or entrepreneurs. In terms of response to social protection, this all became the main institutional vehicle to respond to the crisis. And when you ask the question, what aspects of the Quédate en Casa program or Superte were crucial, the institutional architecture or framework was an extremely interesting point with which to articulate the responsibilities, because together with the Ministry of the Economy and Planning and Development, they could get the statistics and they could check databases to ensure that help could go to the ones in need. The main focus to define the interventions for the beneficiaries was based on the levels of the conditions of life that were developed in this map of poverty designed by the Economy Ministry. And together with the system of beneficiaries using a tool of categorization and focus of the homes by means of the quality of life index, which allows us to know which ones qualify for extreme poverty, of moderate poverty, and in different indexes. So the transfer programs were the main response to reduce this negative impact of COVID-19, of loss of jobs and low income. So the poverty would be worse. In our next slide, we can see a summary in a form of a table to see how this extreme, moderate, and general poverty behaved when the programs were implemented. As you can see in all of the cases in 2019, we have an extreme poverty 2.7%, and with the programs, without the programs 5.2, and with programs 3.5, and also in the general poverty, Carolina Trivelli mentioned, because of the impact in urban areas and rural areas, these programs definitely allowed that in rural areas, the impact was less because of the places, and in urban it was higher. It was acknowledged with discourse and narrative in terms of the speed and the severity that we need to consider in order to mitigate the effect of the pandemic because of the social economic recovery with a focus on these rural areas. And we know that all of the routes to restructure and answer to the new challenges will depend on a constructive approach in the areas of all social realms. And in the question, how they ensured technological innovations of the program Quédate en Casa for the access of rural populations to social protection during the pandemic, definitely we need to think that we need to talk about data, especially the data are, in terms of response, the great catalyzer of an intervention that allows as the 2030 agenda to leave nobody behind. And when we start to see what we had in terms of data, with Sabine and committee, we saw that we needed to strengthen the analysis and data science that would be the main tool to have interventions based on data, which allowed us to make decisions that were more efficient. As we said, that ICV defines a group of social economic variables and demographic and social vulnerability. We to count on an alliance in terms of data, like social security, tesorería, that allowed us to identify people out of jobs, and also allowed for service based on the references made by local institutional organisms that are national and international, like UNICEF, SENASA, CONAVICIDA, among others. The initiatives reached these geographical demarcations by means of local actions like identification by means of SUBEN of the vulnerable families, an increase of the amount and the scope by means of the SUBEN platform. Of course, that at the first time we met more than 800 families, and with the pandemic and the Quédate en Casa program, we increased the number of families to 1,355,000 approximately, which allowed that by means of the data, we could evaluate how other indexes and quality of life of the populations, they behaved in terms of the impact of the pandemic. And definitely there are lots of learning from the management, and we have the theme of the interoperability of the data and how the institutions that work in the social sector should start to articulate response mechanisms for the emergencies that could be generated in a planified manner. And so in this transformation of the Sperate program, we are evaluating and we are defining processes to strengthen the institutional architecture, because they allow us to have with the same design, functional articulation of the organisms of the state and with other groups to provide more integral responses. Based on the question how the lack of infrastructure was met to ensure that the poor rural population benefited from them, a lot of things happened at the same time. In the follow-up that FAO has helped with us, we strengthened our program, and we want to strengthen the work of small farmers and giving them resources so that they can improve the production with access to the population. To date, 30 Casa Sombras were done, benefiting 1,440 new participants, which are in production processes and working in supermarkets. And together with the Agricultural Bank, we created the first funding line that is specialized from 100 million pesos for family agriculture. In collaboration with FAO, with you, we are building 24 productive centers in the border areas of Jabón, Montecristi, and Santiago Rodriguez, focused on the youth and women in order to improve their quality of life. In addition, we signed collaboration agreements with the Embassy of England for a project on water to provide this resource. In addition, and along the same lines of Ms. Carolina Trivelli, we worked on strengthening the strategies for economic inclusion, giving a new look on the program that we implemented before to update things and to have more demands with the private sector and the government, looking at jobs for the future and the opportunity that you have by means of the state to transform the strategies that you have to ensure and improve the quality of life of the population. So considering the improvements that were implemented, we had the financial support to mitigate the effect of the pandemic. We had the assurance of jobs by means of funds that allowed employees to remain on their jobs, to increase the amount and the inclusion of new beneficiaries, identifying new vulnerable populations, to ensuring economic security for the people who could not work during the pandemic, the support to the informal job sector with special funds, the innovation in processes, the effective use of the technology by means of a technological platform that ensured the access to rural populations, allowing them to be identified, first of all, and also that there was an automatized record by means of the use of the internet, the access and availability of online information that was a valuable contribution because the people could consult and could see the pertinence to the program or not. And also a payment scheme. There were accounts, digital accounts created for the people to make everything faster by means of an alliance with banking system, and also to provide them with the Alimentati program card. We used to call Comeres Primero, but that was an innovation with which the most vulnerable homes had the opportunity of receiving economic help. I believe that Latin America and the Dominican Republic are in an interesting place in terms of opportunities. It's a challenge. The name of the availability and the look for information systems, they require a new outlook. They require a lot of more integrality and democratization of the use of data to formulate social policies for projects that can be responses to emergencies in scenarios that require decision-making that's fast. So technological component became an important part of the day-to-day lives of people. And now in our case, like in Superati, we need to be able to rethink the use of the technology and the use of the spaces that used to be to implement strategies. And nowadays, the world definitely showed a change to us, and that requires us to change the angle and offer a new outlook on the theme of this economic inclusion, and to be able to observe how the new economies put new routes to have solutions for these challenges, including economic and the inclusion of women, and to be able to sustain these places with a high impact focus, and also an alignment component, the connection of the needs of each region with the interventions in order to develop things. I think it's an extremely important theme that has been discussed for many years. And now with a technological component, the answer can be even more interesting. And I'm talking about the territories and the focus of strategies that can tend to the particularities of each of the country's zones. And of course, the theme of governance, of the risk to fraud, and the because of the vulnerabilities of the system by means of the detection of people who are being benefited with economic transfers. This also has a large index of response by means of the digital means, because nowadays they offer strength that did not have before. So this was my participation. Thank you very much. Thank you very much, Mr. Bacha, for your presentation. That was very comprehensive. You gave us a lot of details of the intervention of the Dominican Republic in the context of the pandemic. And there are many things that I'd like to mention, but because of the time, I won't be able to mention everything that I wanted to. But something that was very important is that in this case shows that the preparation of the social protection systems that is previous, that's key. The results were achieved because there was previous work done, and this had in the preparation of the social protection systems for emergency. And we believe that the Dominican Republic already counted on a system in this sense. And of course, and related to this point, the use of information of the databases that already existed, like SUBIN, and the articulation with DCS and other sources of information that enabled to quickly identify the beneficiaries of the programs, right? A few operational initiatives that were interesting, the payment scheme and digital accounts using the electoral documents, and also using technology to identify the population and using the internet. So those are a few innovations mentioned in your presentation. And I'd like to invite the participants to ask questions. If you'd like to go deeper on any aspects that our panelists commented in the webinar. And with that, we would conclude the presentations. And now I'm going to pass the floor to our colleague, Alejandro Greenspun. He's an official senior of social protection policies in FAO Rome, and he's going to talk about a few things from the presentations, and he's going to support us by moderating the Q&A session. Alejandro, you have the floor now. Thank you very much, Arniela, and thank you for the regional office of FAO and IPCIG to organize this webinar and to invite me to participate in it. I do need to say that the pandemic had catastrophic effects on the region, and unfortunately, we have not left the pandemic situation because vaccination is still far from over. And so there's always going to be the risk of new moments in the pandemic. So we need to think about that in order to mitigate the effects about the households. And at the same time, we need to think about how to use these lessons in order to promote an inclusive process and equitative in terms of post-pandemic recovery. We need to remember that, unfortunately, we have not left that. So that's why I'd like to talk about this initiative from FAO, of the regional office, and of IPCIG to document and extract that. And I believe that we can learn a lot from that. And also, we want to improve the policies in the region in a permanent manner. We heard from the main findings of the work that we had from the FAO and IPCG, followed by 3 presentations in a very distinguished program. And now we only have 10 minutes, maybe 15 minutes for the Q&A. And so I'd like to begin by talking about a thing that was mentioned many times. Maybe I think Carolina mentioned Arniela and one of the other presentations too. And that has to do with the imperative need not only to strengthen social protection systems in the region in which we still have deficits in terms of social protection, especially in rural areas, but also the efforts in terms of economic inclusion in order to rebuild livelihoods and the economic tissue, let's say, in the rural areas that were affected as a consequence of the pandemic, but that they have always been subjected to problems in all of the countries of the region, right? So the importance of articulating and thinking about the future of these policies and social protection programs with social economic inclusion, with programs coming from other ministries and other sectors. We have here representatives from the Ministry of Agriculture. And I'd also like to go back to a matter that was mentioned before by Arniela, that has to do with the case of Panama. Jose Bernardo mentioned the Plan Panama Solidario, and that it focused on territories that used to be covered by the Plan Colmena, which is the integral strategy for social development in Panama. And what I'd like to ask to Jose Bernardo Gonzalez, if you could give us provisional details, but briefly, in order to have more interventions in terms of the territory and the synergies that were generated and how this articulation could be strengthened, especially in the future. That was a question asked in the Q&A, and I will go back to it. So I pass the floor to my colleague from Panama. Thank you. Well, I need to remind you that the prioritization, so the strategy of Plan Colmena prioritized something together with the UNPD by means of a methodology to prioritize 300, well, at the end we had 300 places with a series of indicators of multidimensional poverty, and they had to do with health, water, education, and other indicators. And most of these places, Panama is divided into provinces and other places in its political division. And in these places, these boroughs are in indigenous rural areas, these townships. And we had this in the multi-dimensional poverty, and they are in these indigenous areas, rural areas. So what we did was to articulate this strategy, the identification of these deficiencies that they had, in addition to low income, with strategies because the pandemic was right there. So intervention strategies that we are doing in the Ministry of Agriculture. The strategy used to identify the needs of the communities, not only for the Ministry of Agriculture, but also for the rest of the ministry. That's done in the townships by means of local governments. And the most important actors are the actors of the communities, the civil actors, who are the civil society, associations, fathers and others, and also local governments, what we call Junta Técnica, which are the directors of public institutions, and they inform the communities about the offer of the public service and public offer. So in this call, there's a discussion about the needs and how to articulate the public offer with the needs. And in the case of having needs that are not in the public offer, you have a plan of intervention. In addition to that, we had in the Economy and Finances Ministry, we had a direction that began in 2020 with its process, and we hope that it becomes consolidated, which is the territorial investment direction, and that gets from these calls in the communities the needs for investment to transform all of that so that the ministry can do its plan. So this basically is the scheme, the framework that is articulated not only with the Ministry of Agriculture, but with other ministries, for example, the Ministry of Public Works that has to do with the works, and also health, and many other ministries. All of the things, for example, the health in terms of water, and also taking the kids to the school. And what we want in the time is the process that began with the pandemic, and we want to strengthen it in three fundamental areas. First, in the capacity of the communities to define or prioritize their needs by means of the methodology that we're starting to implement. The methodology needs to improve in terms of how to identify the participation of the communities in this process. And the other is to increase the offer of services from the institutions based on the real needs of the people in the communities. And the other is that this offer can also answer by means of a mechanism with a new mechanism in public investment that's more focused and it's more oriented toward the needs of the communities. And here we have an interesting theme, because you also have in this process, we are incorporating the local governments, as I said, because of the decentralization, and little by little, we strengthen that by means of this law, and we are beginning its process to have how can we answer to all of that. But for now, the central government is the one that does the public investment, and in the process, we want that in time we can change not only the capacity of management, but also the capacity to be able to make the investment. And for that, we need to transfer financial resources and other resources to local governments. So that was very briefly what I had to say in summarized manner. That's what we're dealing with. Thank you very much. Thank you, Jose Bernardo, especially for saying so much in so little time. There's a question in the Q&A that also points to the same theme in terms of articulation. In the case, it's agricultural insurance like Garantia Safra from Brazil and the CAD Único program that's for social protection. So the question was answered by Jose Carlos, but in any manner, I'd like to very briefly mention it. It's a program from Galatalet, from our colleague in FAO, and he's asking if the farmers that had access to Garantia Safra, if they also had access to Bolsa Familia or other emergency help, and if these programs are cumulative or if they're excluding. This is the first part of the question. And the second of all, if there's also evaluations in so that the beneficiaries could have this transfer, especially if the transfer was enough to ensure not only to be able to meet the needs of consumption, especially in what has to do with basic food needs, but also in terms of productive things. I think Jose Carlos, you already answered, but if you want to answer that here, you can have 2 minutes for that if you would like, because that there might be an overlap between the standard of beneficiaries for Garantia Safra and Bolsa Familia or others. So you have the floor, Jose Carlos, just for a little bit.
Tudo bem. Como eu respondi aí no chat,
As I have answered on the chat, 70% of the audience of beneficiaries, of producers of Garantia Safra program, they also access other public policies, such as Bolsa Familia, which is a social assistance policy. Well, Garantia Safra is a cumulative program. It's not self-excluding. So the fact they received the Bolsa Familia, and it's not because they received the emergency aid that they won't receive the other. They may receive both, even. Another question was with regards to if this amount of this benefit, well, if they use for practices of agriculture, not only for food. No, we don't have specific studies with regards to that, but due to the very profile of our audience, an extremely vulnerable profile, we believe a great part of that use this resource for the for the food security. And the other one is this interface with other public policies. We have seen the need of empowering those producers, and for them to leave this vulnerability zone. And we believe that the applicability, the restructuring with the technical assistance and research, and what was the best culture and the best calendar to plant. Well, we believe that we can boost these producers and perhaps take them away from this vulnerability.
Thank you very much. I did not see that there was another question. That is a follow-up. The Nicole Figueiredo, and he asks if the program Garantia Safra had access to the Cadastro Único in order to enrich the information already there. in the record registration of farmers, and what would be the ideas for the future in terms of connecting Garantía Safra with other public policies?
É,
Ok,
cadê?
se cortó. Entonces,
Oi, voltou, acho que agora voltou, né? Desculpa, pessoal. Em
Now we're
função
back. Well, due to this, the emergency aid, and the cross-referencing of our, well, see, 70% of the people of the single registry, they access Garantia Safra. And so first and foremost, the proposal would not be that one. Well, in the mid to long term, we could be linking the benefit, but this must be discussed in the scope of the government. And at first, we'll link the participation in the program or the use of the benefit with technical assistance policy and rural extension. And with that, to try and improve the quality of life of this of our target audience. Thank you.
muy bien, muchas gracias. Y
Well, thank you very much. Our time is up, actually, for the webinar. So I need to close. I'd just like to ask a question to Adib, since he talked about the records. And Adib, can you hear me? One of innovations among many were not only because of a design or prediction, but because of force majeure, both for the social sector and other ministries and public offer in the state in general. There was no other remedy than to innovate, to provide a response to the accumulation of emerging needs as a result of the pandemic in a context that was very hard to give the response to all of it because of social distancing and lockdowns and all of that. And one of the many things that were mentioned, one of them had to do with the use of records, with the importance of records. And so records of agriculture and many others. So the importance of integrating information and to make the interoperability. And so in your country, you have Suben, and at the same time, in other countries, even in the region, not only the records had complete information or are sufficiently up to date, and that was also a limitation, right? But if you could briefly talk about, because of our time that is up, if you could talk about how you've done things and what types of limitations you had, and especially if you have a few lessons to share with other countries. Yes, as you said, the innovation is the sole vehicle that we have to provide answers to the challenges. And similarly, the component of information and leadership is also important. And that showed us that this interoperability and this alliance between the government in terms of data, that was a crucial thing to provide answers and tend to the needs of people. And to count on the country as an institution, as a sole system of beneficiaries, to have that was a plus, because the entire language and transfer of technology in terms of data they already had a know-how of years. And Definitely, they had as the main use voted to the focus of the monetary transfers that were conditioned, but they had the view since the beginning that the scope of the data not only were limited to the population that was met in terms of the money transfers, but that also allowed that when the crisis was broadened, well, the data needed to be our main ally to make decisions. And with an important aspect of was the alliance in terms of data to provide answers. That was the speed with which other institutions that produce records and data shared with the sole system of beneficiaries. There are databases that allowed by means of different crossings to make new focus. And I believe that talking about lessons learned, we need to invest in the interoperability of the data so as to know in the outlook of social protection and to provide that to all as a focus on people. And that's what we've been doing in terms of the Superati program. Thank you very much, Adib. And with the permission of my colleagues from the socialprotection.org, I would like to know if we can continue for a few more minutes and to provide the possibility of Beatriz to talk about a final closing and to talk about the findings of the three jobs to talk about the regional office. If you talk about the elements that I believe are key to promote articulated interventions in order to look for the future. Beatriz? Well, just to answer that very briefly, the records were crucial infrastructure so that the different programs would communicate. And also, I believe that related to that, you have social and civil records and also peasants, and also the collaboration, not only in the state and in the different ministries as social development and agriculture, but at the different levels of government and also for other actors. We saw the importance of the cooperatives and solutions with indigenous people and fishermen and peasants. And that's also crucial to mediate tensions related to the work on the land and agriculture. So those are marginalized populations, and sometimes they don't trust the government. And so to cooperate with these communities by means of the organizations, that's also a door to for the state to access those communities. And since our time is almost up, I believe these were the main elements as an emergency mechanism mentioned by Carolina. So the short answer would be that. Thank you, Beatriz. I'd just like to emphasize 4 messages before I conclude. They came up during the webinar. Knowing that the pandemic made problems worse, problems that we always had in the region, even before the pandemic, in the previous decade, the region saw an increase on the poverty rate and food security, and that was problematic during the pandemic. But there is an agenda that comes from before on that this is going to be a challenge to implement that to the interventions that we have and the restrictions. And we see that the recovery of the pandemic is going to be slow, and it's going to 2023, so that Latin America and its group can have the same level before the crisis. So in this, we see an agenda that is long-term. I'd like to mention a few points. One is the importance of progressing toward universal redistribution systems of social protection by having more cover in themes not only of social assistance that was important in the last 10 to 15 years, but you also have to ensure and have policies to promote jobs and the production. Those are two areas that are important, two tools for social protection in which the work that you are doing is important, and the outlook needs to think about those problems, thinking about the needs and aspirations of groups that have historically been marginalized, like the original peoples and Afro descendants, African American. And another one is the opportunity, which is to use innovation that we had during the pandemic. As was said, because of force majeure, to incorporate the tools that are available to improve the management of the policies and programs in accordance with the most vulnerable population. Today, we heard from several of those in terms of digital information and information for Garantia Safra in one quote instead of 5. So the simplification to simplify records in the program, or to verify in terms of the loss of crops. And the other one, it's a thing that FAO considers a lot, which is to acknowledge family agriculture as a productive sector that is subjected to rights, and not as a vulnerable group that should only have assistance programs. So you are analyzing the work in this direction. I believe that there's an important acknowledgement of the region, right? That the family farmers, they need an essential role in the agricultural system of the region. And so it's about time that public policies acknowledge their strength. And last, we need to progress in the design, something that came up that was very strong during the webinar, the design implementation of strategic integral coordinated policies to think about social inclusion policies and the ones that have to do with production support. So you could have both in double inclusion, and only with that we can advance in a sustainable manner to reduce poverty and think about food security and have justice in our continent. I'd like to emphasize those things. There are others, but in this case, we like the time. So I'd like to thank the organizing committee. I'd like to thank the audience and to give the floor to Arniela so she can make the closing remarks. Thank you very much, Alejandro. Thank you very much to all of our panelists and the participants. And in January, you will find a document that's published in the FAO webpage. Thank you very much and see you soon. Thank you very much for the invitation. Thank you, everyone. Thank you. Thank you very much.
Abrazo.